She's an assistant professor here at Lynchburg College, DPT program for 8 years now, with teaching responsibilities in the professional practice series. While attending the CSM, she decided to attend a course that focused on dealing with inappropriate patient behavior, instructed by Ziade Cambier, because she thought the content would be really useful for the professional practice classes. Based on what she learned, Dr. Wheeler decided that indeed the content was important enough that all physical therapists and student physical therapists could benefit from learning how to cope with this issue. Therefore, today's presentation is based on some of the concepts from the education session. Everyone please welcome Dr. Wheeler.
Oh boy, you all are in for a treat. I used to teach professional practice, and it was always an interactive support. So again, it will be an interactive sport. So I'm going to try to get through the first part. I will ask that you hold comments, questions, and all that till the end, because I do want to get to the very end part, which is the meat of the matter. Okay? So just, I usually say, ask me as we go along, but this time I didn't give me enough time. So you know. All right, so this is actually what we're really here for, because wouldn't it be awesome if all our patients behaved in a way like they're compliant with our home exercise program, and they didn't do, well, they don't usually run across the field in our clinics, but, you know, do stuff like that. And unfortunately, in reality, patients don't always behave the way we want them to. Okay, so I put up here IPSB because what I'm going to be talking today about a little bit more specifically is inappropriate sexual behavior. And so it can make you embarrassed. It can make you, so I keep saying IPSB to kind of take that away if you don't feel comfortable with that particular language, and some of you don't. And the thing about this type of behavior is, if you can see it really closely, there's one guy all the way over to your left that's turned around, and if you can see his face, it's like this, right? Because when stuff like this happens, it is very shocking. And sometimes you can be like, I just don't even think that even happened, you know? And so it may have already happened to you in your tech work, if you were a tech. I mean, this is actually pretty common, unfortunately. And so there is some research out, some data out. I was using some old data that was really with healthcare versus PT, and now we've got some specific data out. Unfortunately, I don't have the full article there, and I think it would be really interesting to look at. But I did get access to the abstract right here. And so, you know, most of us think, oh, that's never going to happen to me. Unfortunately, career prevalence means, yeah, it says yes, it will. Okay? Yes, it will. And even over the coming year, half that responded to this. This is 800 physical therapists that responded, physical therapy students and physical therapy assistants. They responded. So it's a good chunk. Now, I don't know distribution of males to female. I don't know all that kind of information because I didn't get to read the article. But man, that's really shocking. And so that just reconfirmed the fact that I think that this education needs to hit all PT students in one way, shape, or form. Okay? Unfortunately, they did identify some risk, and that's fewer years in direct patient care, which usually means that's you guys. You're coming out and graduating and going to be new practitioners. And maybe it's because you're younger and prettier than us old fogies. I don't know what the deal is there, but unfortunately, that's what it affects. So again, reconfirmation that we need to talk about it. The other thing is cognition. We're not going to really go into that too much, but being a female and then having a male patient usually seems to be the most common things. But interestingly enough, from being in the clinic and what I've observed, I've actually seen more issues with male, either PTs, techs, or along those lines than I have with female. So I thought that was pretty interesting. So I don't know if I'm just skewed or if the data may be skewed a little bit too. So it depends on the things. Just so you know, there actually are appropriate sexual behaviors in the clinic, but they're not as many as there are inappropriate, okay? And so that is, there may be somebody who had surgery or something like that that's wanting to return to normal sexual function, and that is normal. That is normal and what we want. We want patients to be safe with these types of behaviors. So that is a good thing. We want them to talk about that. The other thing you may be surprised about, and as you go, a lot of you are going to go into skilled nursing, that in long-term care facilities, even with the older folks, the drive doesn't go away, and that's okay because that's where they live, right? So remember, you're going to their house when you go to those kinds of places. And so even though they're not in their house, that is appropriate. Of course, not right out in the middle of the common areas or at the lunch table, all those kinds of things. But just understand that you may observe some sexual activity in long-term care, so you may have to deal with that in some way. So why is this really complicated? You may say, well, I'm just not going to treat that patient. I'm just not going to deal with that, right? And the problem is that our association, first of all, our laws tell us that we have a duty to treat, okay, a duty of care. So we can't just discharge our patients with no warning. We can't discharge them without any reasons. We have to have some sort of reasons. We have to have some sort of continuum of care for that person. We can't just drop them, okay? And I'm going to tell you, it's not just people that do IPSB. It may be other ones too that you may want to drop, but we don't get a choice in that matter. And so that is actually, law is considered negligence if you don't do those kinds of things. You can be sued, okay? The other part is our core values speak to this as well. I mean, we are altruistic people, we are caring people, and those kinds of things, and we want to promote excellence. I mean, that is part of our association. And then, of course, we have multiple different places that in the Code of Ethics that speaks to this type of issue as well. On the other hand, what about our rights, right? What about our rights? What about our rights as an individual? And so you actually do have a right. I'm not sure why it's so small on one side and bigger on the other. But anyway, you do actually have a right to a safe work environment, okay? And so know that. And that's something we can talk about later if you want to talk about it more. So why does it happen? In most cases, there is a motivation. And this is really, really focusing in on people who are cognitively intact. I just want to point that out. But there's a lot of reasons. I'm going to let you look through this first list so you see why people do it. There are lots of different reasons for motivating behaviors for why IPSB does happen. And then they continue. Lots of different reasons. Now, there are some, of course, that are medical. A lot of them have to do with having some cognitive impairment types of things. We're not really specifically talking about that today. I don't have enough time to do that. But I will tell you that a lot of behavior management is pretty similar to what we'll be talking about today. Just going to have to be a little bit fine-tuned on there. And then there are some resources for children as well if they act inappropriately. And we're not going to go there today, but if you Google it, you will find some really good resources there on what to do if you see that. Okay. So there are multiple ways to manage this type of behavior. Okay, the first one you might think of is to ignore it. Maybe it'll go away. The other, and this, this is my bad thing, is I like to make jokes about everything, and humor. That's another way to think about it. Do avoidance type of strategies, and then be assertive. What I will tell you is the first two are dangerous. Okay, if you ignore it, then that can imply that the behavior is okay. And certainly we don't want that type of behavior. So sometimes you think ignoring it, it'll go away, but in most cases it does not go away. So addressing it or doing something different is important. If you make jokes about it, that can also escalate the behavior as well. And so that's something you got to consider. For people like me who likes to joke about everything, we really have to take this very seriously because we don't want it to escalate. It can create a lot of problems, not only within the workplace, but with you. It can affect other patients because you're bothered by this patient that's affecting you psychologically. It affects productivity, it affects all sorts of things. So what we're going to talk about, since the other two are not effective strategies that you might want to choose, we're going to talk about the last two. Okay, so we'll talk a little bit about avoidance. One thing that you can do, maybe you go in and you treat your patients in private rooms, is this person now needs to come into the PT gym. Okay, now that can become a little tricky because if the patient needs something where they're exposed, and all you first years are so good at draping that you will have to use your excellent draping skills in this case, right? And that can limit sometimes even the types of treatments that you might want to do. just because of that exposure. And so is that excellence? You know, you have to make those kinds of decisions. The other is having staff present, which can be a productivity issue, is always having somebody with you. I say that's a great idea, and that may actually be what works, and you know, it certainly is okay, but there are negative things to go with that. Definitely choosing different kinds of interventions and limiting time. Then we start wondering, again, are we maintaining that excellence core value that we really want with these types of patients, and with all of our patients, not just these patients. And so you have to think about this. You have to really weigh those kinds of things. And the other is establish emotional distance. And I know that you all are getting hit left and right about this therapeutic alliance that we want to have with our patients, so we can create a relationship of trust so that we can accomplish our goals and accomplish their goals, more importantly, and we get good outcomes, and et cetera, et cetera, et cetera. And we want to have relationships with our patients. But keeping that emotional distance, yeah, that may stop some of the behaviors, but it may not. It may damage that relationship and damage that trusting kind of thing. So it gets to be really tricky with that. But certainly this is a strategy, and it certainly may be a place where I would even start a little bit. But unfortunately, it's not as effective as we would like it to be. You know, 50%. So, but I think it's worth a try. Okay. So the other alternative then is to be assertive, right? Speak up for yourself. I was thinking about this hairband song in the 80s called Quiet, you know, it's Quiet Riot, and they do, we're not going to take it anymore, you know, kind of thing. That's kind of what the assertiveness was. The thing about being assertive is there's a very big difference between me going up and shaking my finger in somebody's face and being like, you better stop that, you jerk, you know, those kinds of things, versus doing it in a professional type of way, right? But we have to make sure that we are clear, we are precise, and we're going to talk about strategies to do that in just a minute. We're direct, and that we're taking our emotions out of that for the most part. Now, sometimes we will say, okay, this is how we feel, but our emotions can kind of get in the way a little bit with how we react to what people do, and that could be on a lot of different realms, but also just really trying to stay in the facts. And sometimes the facts are how if that person does make you feel, so that can play into it. But you have to downplay that just a bit, okay? And then using medical terminology. If I say the word boobies to you versus breasts, I mean, some of you are trying not to smile because I said the word boobies in the middle of class, right? And so, but breast is a medical term, right? And so just thinking about how serious do you want to communicate what you're trying to tell this person. And we are very serious in this. Again, we're taking the joking and all that stuff out of this because that can be dangerous. We do have to use those medical terminology. Okay, calm, non-threatening, those kinds of things. But I'll keep it professional. And then thinking about not being threatened. Again, it's that shaking that finger right in front of somebody's, or even clenching your fists or something like that, because it will make you angry. It can make you very, very angry. It can make you feel powerless. It can make you feel a lot of different things that you don't necessarily want to convey to that patient. But just keeping direct, open, just a calm type of voice is recommended as well. I think this is probably the biggest one, is the spirit of I am in control. And in these situations, you may feel out of control, right? That's actually what it does a lot. It makes you feel out of control. But you want to give that spirit, you are in control. And actually, that's my purpose today, is to give you some strategies that you can use that will give you that feeling of I'm in control. Okay? I always tell people to take control of the patient interactions, and you are the leader in that patient interaction, and you got to keep it that way. And sometimes it's really hard to do. So we're going to talk about two specific strategies. One's called the three-statement structure. You will need a partner, so you may as well find a partner. Okay? And we're going to do some things. Now, I'm not going to make you say like terms about private areas. I'm going to bring it out of that, and we're going to practice a little bit. But I'm going to give you an example of the three-statement structure in just a second, and then we're going to talk about the positive-negative warning, which is actually a lot more serious than the three statements. Okay? So I don't want to, with these, they're going to sound fairly simple. Simple is easier to remember for one thing, but I want you to understand it's not simple to deal with, and I understand that, but I'm going to give you something, two ways to look at this that's more simplistic. So the 3-sentence structure is like this, and they can be like kind of run-in sentence. You can put an and in there and actually make them 2 sentences, so that's not the problem. Is first you start out with the assessment of the situation, and you can do that in a positive or a negative type of strategy. It does not matter which way you choose to do, okay? So the positive would be like, I think you're a good person. The negative would be, I don't think you mean to upset me. So again, it's using those not type of words. It's not being negative as in you stink. It's more about, it's more of a negative statement just because you're using not, okay? And a lot of times we say, you know, don't do things. And of course, that's what you really want to do is when you say don't, right? And so sometimes that can be counterproductive. But for the most part, negative doesn't matter in this case, okay? And then you do actually your emotion. How does this make you feel? So I don't think you mean to upset me, but I was embarrassed when you grabbed my breast, okay? So you're stating the facts there. You're not giving a lot of details. You're not being, you know, going over the top and having a meltdown or anything like that. But it just tells them that you did have an impact they had an impact on you, excuse me. And so that you're very clear about what that impact, that it is a negative impact, okay? And the conditions for a continued relationship. I want our relationship to remain professional, or you can be very specific, and this is the one I like best, I want you to stop touching me, okay? Again, it's being very precise. It's telling you exactly what you want. This should be very clear if you speak in this type of way. Now, I want you to notice that I did not say you in this one for the most part, except I started everything with an I. And so that becomes a non-threatening way to deal with conflict, okay? It's a non-threatening, accusatory type of way. Because what you're not trying to do is belittle the patient. You're just trying to reestablish the fact that you're in control of the situation and that you want them to stop whatever the behavior is so that you can continue on with that professional relationship. Okay, so let's do a practice. Hope you all have a little partner going on. So I promised that you would not necessarily have to do this. I'm going to go back, by the way, and so you can use a 3-statement structure. But here's the case. Use a 3-sentence structure to do this, to address this. Your patient has an extreme swearing problem. Okay, he or she drops the F-bomb in every sentence. To make matters worse, he or she talks really loudly. I don't know if your partner is a he or she. That's why it is he or she, by the way. So during the last treatment session, the patients complained about the behavior. So I'm going to go back so you get that 3-statement structure. You don't have to necessarily use I and how it made you feel, but you can certainly use that if you would like, but just practice it using, oops, that's the wrong way. Nope, hold on, let me go back this way. There we go, there we go. All right, go, you got like 2 minutes.
You're a good person, and I don't think you mean to upset me by using that language. Actual needs. I felt offended.
You could say yes. It really offended. Your choice of language really offended me. Your choice of language offended the patients too. Other patients in the gym. Yeah, absolutely. Please stop saying. People that really swear all the time, they don't even know they just happened. So it might slip. And you're going to have to work with it. This is the start. Okay. How'd that go? How'd that go? Did anybody come up with a good, direct way to that they want to share? Their 3-sentence structure, 3-statement structure. Anybody want to say what they did? Go ahead, please.
I think you don't have any bad intentions. I have been asked by I was told by other patients that they have been uncomfortable with the language that they hear when you are in the clinic,
like if you could keep it as a G-rated language while you're here.
Okay. Okay. Right. So did you all sound fairly similar? Yeah. Yeah. And you could just be really even, if you want to make it really simple, just say, please stop swearing in public areas. You know, in our public gym. You can do that. A lot of people that do the swearing, especially the swearing type of behaviors, unless they have cognitive impairment, sometimes they don't even know they're dropping these all the time. And so this is something you may have to work on repetitively because they don't even have a clue that they're actually doing this type of behavior. I would say in the cases of IPSB, you might not have to, hopefully you will not have to come back to it as much. But certainly this type of behavior happens in the clinic too. But this is a nice way to address it. It's short, sweet, and to the point. The other thing, who in here, and you don't have to raise your hand necessarily, but who in here really had to think about what they wanted to say? If you did, first of all, I gave you a sentence structure that you're not used to. But really think about how you want to say things versus reacting. So it's okay that maybe if they start, you know, they come in and you've done the eval, you notice they swear a lot, and then the next time they're in the treatment gym and they are just swearing at the top of their lungs, and you're just going, oh my gosh, this is terrible. And so you may want to address it at the very beginning, at the next session, and that's fine. That's definitely appropriate. Again, thinking about location of where you talk about this with the patients, because you don't want to necessarily embarrass them or to humiliate them as well. So just keep thinking about all of these things that go into it. Like I said, I'm trying to make it very simple so you have at least something, but at the same time, you know, these are not simple issues, okay? All right, so then, oops, we already did that. So the next one is a lot more serious, and this is a positive negative warning, okay? And so what this one does is it gives repercussions to the continued behavior. So most of the time we will start doing something with like that three statement structure. If that doesn't work, then we go here. Now, the other thing I want to disclose here is if you really are having troubles with this, please go to a manager, okay? First of all, you do have the right to a safe work environment, and so you just go to your manager and be like, I am feeling threatened, and the manager actually has a duty then to address it in one way or another. The other thing you want to do is you want to know policies and procedures. Okay, there should be some sorts of policies and procedures for this type of behavior. So then you don't have to just, which we're going to do today, is we're going to just make up our own repercussions. Okay, and so you don't go it alone. I think it's probably the moral of the story more than anything. But so anyway, this is used more with the repeated behaviors and allows for warning before withdrawal of services if that is indeed the repercussion that needs to happen. Okay. Just gives you a nice way to say consequences. All right, so an example of this is, if you stop showing me your genitals, I'll continue to treat your back pain. Okay? Really simple. Here's your positive, stop doing it, and I'll continue. All right? The negative would be, however, if you continue to expose your genitals, I'm canceling your treatment. Okay? So the positive is, I'm going to stay and we're going to keep on with this treatment. The negative is, if you don't, sorry, I'm canceling you. Okay? And so that gives those consequences. So sometimes you have to have consequences in mind. The other thing you have to think about is you have to be able to do consequences that are within your power, right? So saying consequences like, I will run over you with my car, when that patient knows that they're not going to run, I mean, it does make you mad, right? So you're not going to really run over that person in your car. Well, I hope you won't run over that person because you're going to go to jail regardless. So just keep that in mind too. You know, or I'm going to punch your lights out or something like that. You know, again, we're trying to keep it professional, right? And you may feel like punching their lights out. I mean, you know, that might be what you feel like doing, but quite honestly, you have to be able to have some sort of backup, and that's one reason why we say have support of your management, right? I'm going to transfer you to another therapist. I'm going to stop your treatment session today. I'm going to terminate our treatment as well. And we talk about that a little bit more in detail, okay? But those are some of the things that you can consider as well, or I'm just going to stop this, whatever treatment it is, just altogether, okay? And we'll do something else. So that's a way that you can do as well. The other thing is if they know, if you do say something like, I'm going to punch your lights out, they can escalate more, and we certainly don't want that to happen as well. All right, so guess what? We get to practice again. All right, we're going to use the positive negative warning. Here it is. Your patient has been discussing, this was a little sketchier. The patient is discussing relationship issues with you. You shared that you're in a relationship and some of the arguments you've had with your significant other. So again, we try to make a relationship. We try to create connections with our patients. So that means we share sometimes our personal self. We do get to know our patients very well. Sometimes you feel very, very connected with your patient. So this is pretty common. But during the last visit, the patient asked questions about your relationship that made you feel comfortable. So it was, maybe you were telling them that you were going to go out to a nice dinner to Robin Alexander's or something like that, and your patient kept asking more questions to be more specific, which made you feel like really weird. Okay? You used the 3-sentence structure to address the concern, emphasizing you wanted the relationship to remain professional. However, during this visit, the patient went down that road again. Okay? Now, I'm going to go backwards so that you know what the positive, negative, oops, that's the wrong way again. Positive, negative warning. Let's do a practice. You got 2 minutes, go.
Had a conversation before about then we're gonna have to discontinue the party. I don't know how to word it. So, if you don't start pressing, that's how we discuss. Or maybe even like if you can't discontinue from saying if you until they get something to say that we can't. You can do like questions that are professional.
Okay. Who came up with a nice consequence that is, I mean, this one I'm not sure we have to, terminate the treatment right away, but maybe, I don't know, it depends on how personal, I guess, but who came up with a consequence that you feel would be effective? Anybody come up with something particularly interesting? So maybe you did decide to terminate, I don't know, treatments altogether, you're done, fired completely, kind of thing. What'd you come up with?
You could say, like, if you continue to do this, then I'm going to get another therapist to work with you, and
Yep.
I like our relationship that we have. I feel like it's good, but
Yep.
I feel uncomfortable with you.
Yeah, you have to remain, I need to remain professional. This is my profession. And so therefore, yes, I will transfer you to another therapist. Gotcha.
How do you feel about telling them that you're going to make them do exercise?
I don't know that you can make somebody do anything to start with. I think that can be taken as joking a little bit. And so I think that, I guess we can, but we want to do the best interventions possible. So are those the best interventions? My first question. And then second of all, then they cannot take you seriously with that one. And so, because it's kind of it's a lot lighthearted. But if you've been in this type of situation, I would say this is probably pretty common, more so than maybe exposure of the genitals kind of situation, although that does happen sometimes too. Then I would vote that this is probably where you're going to hit most of the time. And I think that certainly transferring, I don't remember who said it, but transferring to another therapist if available or something of that nature sounds really, it's a lot heavier. So then they understand the seriousness, because we've gotten to this point, it's pretty serious.
Could you also say something, it's not quite as strong as that, but we can no longer have these kinds of conversations at all?
Sure. I will no longer talk to you about anything except for physical therapy related. Absolutely. Again, there's consequences for that as well. So I am out of time. Is there any questions that I can answer quick?
Do you have to document all of this for Right.
So if you get into consequences, particularly that you're going to terminate treatments or you're going to do transfer of services, yes, and I would. That's a good question. That's a little bit longer than what I can answer here, but the answer is yes. You start if the behavior continues, you will want to document. Absolutely. So hopefully I won't get to your take-home points, unfortunately, but I hope my take-home point for you is don't go it alone. Okay, first of all, hopefully you know from the data you're not alone if it happens to you. And second of all, don't go it alone. Please, if you're just not even sure how to talk to your employer about this, or your CI, or any of these people that you encounter, contact one of us here. I mean, just because you graduate or just because you're gone, that doesn't mean you're gone. Okay, contact one of us. We'll always be here, and we can try to help you as much as we can. Okay? All right, enjoy the rest of your afternoon.
What? No jail time. What if you're treated out of jail? What if you're treated out in jail? And then you start talking about problems.
What if you're in jail?
Continue trying to my